Hi, I'm Dr. Patrick Foy. I'm a MD or medical doctor, and I am director of the Tailbone Pain Center or Coccyx Pain Center here in the United States, online at www.tailbonedoctor.com. And I've been asked to make a video about what it feels like to be a person with tailbone pain. And this request came from somebody online who said that she really appreciated the educational content that I put out. I make a lot of videos and blog posts at tailbonedoctor.com and on my YouTube channel, providing information about tailbone pain from the perspective of a physician who treats thousands of people with coccydynia, tailbone pain. And that content has really been focused on things like X-rays and MRI and CT scans and the anatomy of the tailbone, and basically providing medical information with the idea of empowering people who are suffering from this condition, so that regardless of whether they get their, regardless of where they get their medical care, because most of them won't be able to make their way, here to see me at the Tailbone Pain Center, that they're able to sort of navigate the medical system and understand their diagnoses and understand their options as far as tests they can have done and treatments that are currently available. But her request was, could I do a video explaining what it's like for patients themselves? What do patients tell me that they experience? What are the obstacles or hurdles that they face? And with the idea that she wanted to be able to share this video with her family or friends or coworkers, so that they would get a glimpse, of not just her, saying what she's, saying about what she's going through, because at times she says they feel like maybe it's all in her head, but really, what do we see in patients, nationwide and even internationally that come to see me? What are the complaints and the challenges that people face? So that's what this video will talk about, and we're going to talk about everything from work to home to family to relationships to physicians, and try to just spend a minute or two or three on each. So how about work? Well, there are lots of jobs that require sitting down. And sitting down is the worst thing for somebody with tailbone pain. So if you have tailbone pain and you're trying to sit down in a chair, especially if you have to sit for a long period of time without being able to get up, like if you are a bus driver, a taxi driver, an airline pilot, or a flight attendant, where there are times when you just can't get up in the middle of wanting to, or you're an attorney sitting in court, you can't stand up, just at will throughout the day, or even if you're working a job where you're on the computer all day, where you're in your cubicle and you have lots of work to do, or you're traveling, as a salesperson in the car back and forth throughout the day. There's lots of times where in modern society, we're expected to do a lot of sitting. So tailbone pain can cause a lot of problems in that context, because tailbone pain is typically much worse while the person is sitting, or sometimes while going from sitting to standing. So it can absolutely impair somebody's ability to work. And at times there's people who, there are people who, depending on their severity of their condition and the type of job they have, there's times where people cannot work. They're unable to continue their employment because of tailbone pain. I had a patient years ago who was basically based in New York, but had a multi-million-dollar contract. Was a business owner, had a multi-million-dollar contract with a client on the West Coast that they gave up the contract because they said there was just no way that they would be able to keep flying back and forth to the West Coast in order to keep meeting with and servicing that client. So this can really have a profound impact on somebody's employment and their employment options. So that's in the workplace. How about at home? At home, it can cause a lot of problems in terms of stress within a family, where you're not able to sit on the floor to read or play with your children, or your spouse or a significant other or partner may not understand why you can't go out to dinner or to a movie with them, because you're not able to sit for that period of time, or just overall, the patients will tell me that their life starts to revolve around what's going on at the tailbone right now. If I'm out and about and I needed, and I had tailbone pain, patients will tell me that they're looking at how soon can I get home before do I have enough medication with me, pain medication, to last till I get home? Or they'll say something like, am I able to, find a place to sit comfortably if we do stop for a bite to eat before we go home? Do I have my cushion with me? Because if I don't have my tailbone cushion, there's no way that I could stop at the diner to, grab a bite to eat. Those are the kinds of things that come up over and over again. And people really find that their life starts to revolve around, how is the pain doing at the tailbone? How are they tolerating it right now? How is today a good day or a bad day? And that can cause a lot of stress and friction within families, relationships, on the job, all of those types of things. And tailbone pain fits into the category of what's called an invisible disability. I'm essentially a disability physician in the sense that my field is physical medicine and rehabilitation, a field that specializes in treating people with disabilities, whether that's somebody who has a stroke, a spinal cord injury, they're paraplegic or quadriplegic, or they have an amputation, or in the musculoskeletal and pain realm, they have back pain, or in my expertise area, tailbone pain. But people have various conditions that cause impairments and disabilities and handicaps. But tailbone pain is an interesting one in this context, that it's an invisible disability. People can't see that there's anything wrong with your tailbone. They don't see you with your arm in a sling or a patch on your eye, or you're using crutches, the way that some other medical conditions and disabilities are very visible to somebody else in the public, or a family or friends or coworkers, so they may be more likely to have some sympathy or empathy for you, or hold the door open as you're coming through. But for people with tailbone pain, you pretty much look like anybody else. There's not an easy way for someone from the outside to know the pain and suffering that you're going through. And therefore, all people can see is that you don't want to join them to go out for drinks or dinner or a movie after work, or those kinds of things, or that you're not willing to drive an hour and a half to go to a family member's wedding, and you really can miss out on some social things along those lines. It can cause stress within a relationship. And there's a lot, and there's a certain amount of stigma around the tailbone. I have an entire chapter. Actually, I have an entire book on tailbone pain called Tailbone Pain Relief Now. And there's a chapter in here. I flagged it here. I'm trying to do it with the one hand hold up. But basically, there's a chapter here on overcoming stigma, for people who have tailbone pain. And basically, the stigma about tailbone pain is particularly among physicians, frankly, which is that lots of doctors do not understand tailbone pain. They don't know much about tailbone pain, and sometimes they can become sort of dismissive, where they don't know much about it, so they pretty much don't give patients that much attention when they're suffering from tailbone pain. They don't know the appropriate tests to order, the sitting x-rays, x-rays that are done while you're sitting down, since that's when you have the most pain. Most doctors just don't know about it, or they don't know how to interpret the images, or they don't know how to order the right type of MRI or other studies. So pretty much every day in my practice, I'm seeing new patients who come to me with the wrong studies done, or who've been seen by physicians who frankly have either told them or implied that it's all in their head, which is really ironic, because it's at the exact opposite end of the spine. It's down at the bottom end of the spine. The problem is in their coccyx. And in the vast majority of these patients, when we go through and look at the studies that have already been done but misinterpreted, or we order the appropriate tests, the vast majority of the time we're able to identify the actual abnormality that the person is suffering from. And on the one hand, it's really gratifying as a physician to be able to help people, to provide an answer for the suffering that they've been going through for months, and in many cases years. And on the other hand, it's frustrating to see, year after year, that physicians are essentially not providing the kind of care and compassion and evaluations and treatments that these patients need. So this is, again, just a video in response to the request from somebody who, requested it of me online, that she wanted to share this with her friends and family so that they would have an idea of what is it like to have tailbone pain? What is it, what do people go through, from people that I see nationwide and internationally, so they can see how that fits with what, what you may be going through, or if you're a family or friend watching this, what your loved one, may be going through as they suffer from this condition. If you want to read more about this, certainly you can visit me online at tailbonedoctor.com. Or on Facebook, it's facebook.com/Tailbone Pain Center. Or if you want to get a copy of the book, Tailbone Pain Relief Now, you can get that on Amazon, on the United States Amazon site. You can is where you can get it online. Or at the time that this video is being made, you can actually get it for free. You just pay the shipping and handling at tailbonepainbook.com. So, if you're interested in more information on this topic. So, I hope this is helpful. If you are someone suffering with tailbone pain, certainly feel free to share this video with people that you think may be helpful for them to hear a little bit if this rings true for you to the kinds of things that you're facing or going through. Okay, that's all for now, and hope this is helpful. Bye-bye now.